Well, good morning and welcome back to the Broadcast Retirement Network. I'm Jeff Snyder, and this is BRN AM for Friday, January 22nd, 2021. And here are our top stories. Ways your boss may help bolster your retirement savings, and changes to the ways you get health care. Well, joining me now to discuss this and more is Alessandra Melito. She's a journalist with Market Watch. Allie, Happy New Year. Great to see you. Thanks for joining us this morning.
Yeah, nice to be here. Thanks so much for having me.
Yeah, it's always great to see you. And again, just for the audience's benefit, Allie and so many of our contributors, I mean, they write full time. They're doing so much work and they donate their time, just 10, 15 minutes a month to the network. So Allie, let's talk about ways that your employer may help bolster retirement savings. But before we get to that, let's talk about the makeup now of the U.S. Senate, the Congress, and the presidency, because things have changed.
Yeah, lots has changed. So now we have a Democratic-led Congress, and we also have a Democratic president. And with that, there will definitely be some changes to legislation. Currently in the works, I know are a few modest proposals about retirement security, like the Secure Act 2.0, which when I've spoken to experts, they've said that is something that is likely to pass. There's always bipartisan support when it comes to retirement security. But one big question on people's minds is what will happen to Social Security, because Democrats tend to be more forgiving when it comes to expanding or improving the program, whereas Republicans have typically, their proposals have been about cutting benefits or just holding off a little bit. And that's something that we as a country can't really do for too much longer. The trust funds that support the program are expected to run out of money by 2034. And then on top of that figure isn't even taking into consideration the effects of COVID-19 on the program, which, there are so many different factors that go into that, as well as the unemployment rates and things like that. So the deadline might be even sooner. The only problem is Social Security is, usually untouchable. It's something that a lot of different political parties do not agree with. Like I said before, Republicans are more likely to propose cutting benefits or just holding off, whereas Democrats are more likely to suggest raising income taxes or things like that. So, and another problem, even though there is a Democratic-led Congress, Social Security is one of those things that it's not a 50-50 vote or a 51-49 vote. It's not something that the vice president can just break that tie. It has to be a supermajority for Social Security legislation. So there's a better chance of seeing something on Social Security sooner, but it's not like just a shoo-in.
Yeah, so that's the lay of the land in DC. So let's talk about it, and that all has to be figured out in the next 4 years, 2 years, whatever the time frame is. Probably 2 years, because that's when the next set of elections are here in the U.S. But let's talk about what employers are doing. I thought this was a fascinating article that you wrote. What employers are doing to bolster retirement savings for their employees. Lots going on there, Al.
Yeah, so employers are trying to help their employees any way that they can. Everybody has been hit by the coronavirus crisis in some capacity. Sometimes these are small businesses that are really struggling, and at the moment there's not much that they can do because they're just trying to survive. But for the ones who are lucky enough to have employees that can stay on and they can try to help their employees in some way, they're looking at things like helping with student loans and, either paying a part of their student loans or working some sort of program so that they're contributing to student loans, but employees can continue contributing to retirement as well. Because right now, student debt, it's a huge barrier for a lot of people to save for retirement. They're younger, they may not be at their peak earning, and they have to divide their income into so many different categories: student debt, housing, car payments if they want to start a family. There's a lot going on there. So retirement isn't always a top priority since it's so far away and people don't typically think about themselves in 40 years. But lowering student debt for an individual could really allow them to, pay into their retirement account, also get rid of some of that debt for their 30, 40, 50-year-old selves, and, just find that little nest egg for themselves. Another thing that employers are doing is opening brokerage windows so that people can make more individual choices for their investments. That's obviously a very small factor of people who are probably going to be interested in that, because some people are, they see investments and they get stressed out, and they don't know which choices to make for themselves because, there are just so many choices and finances can be complicated. But there are people who do know what kind of investments they want. And if that's something that they're interested in, they now will have an extra opportunity to pick things outside of what the plan would typically provide to them. And I'm trying to think. Oh, and also another big trend has been auto enrollment and auto escalation. Yep. Those are big behavioral finance things, but basically it just says that the employer will automatically put a new employee into a retirement plan as opposed to having them opt into the plan, which is less likely to happen, at least anytime soon, when they start a job.
Yeah, I mean, all those things are really important, put in place by the Pension Protection Act in 2006, which seems like years and years ago. I mean, it is years and years ago. Ali, one thing I wanted to ask you about, in reading the article, another benefit I saw is that when it comes to childcare, when it comes to being a caregiver, employers are being a lot more flexible there, having lived through their employees, and maybe some of the senior management having to take care of elderly parents or children who can't go to school and they actually have to be taught. So there's becoming a lot of flexibility in the employee benefit space there as well.
Yeah, absolutely. So I think the pandemic has really ushered in this whole new concept of working from home. Like, I know people did it before, but we were forced as a country to do it, for the most part, for those who don't have to be at their jobs to do their jobs. That is something that I think employers will be doing a lot more of, just, providing that ability to work from home or to provide childcare or elder care. A lot of people these days, it's not just children that they're taking care of. It also is older family members that, like parents or grandparents. And employers are they're either providing some sort of time off for these people to take care of their loved ones, or they're providing some sort of other benefit that can support them. Because caregivers, they're not just taking care of family physically, maybe going to the grocery store or, changing a light bulb or something like that. They're also, in some cases, financially supporting their family members. It's also a very emotional time. Caregivers, sometimes they have to leave the workforce. They either have to shift to part-time, or they have to just leave the job altogether because there are a lot of responsibilities, and the pandemic has made that a lot worse for current caregivers. So it is nice to see that employers are taking notice of all of these family responsibilities that they have, and they're incorporating it into their workplace. Just because if they didn't, there are a lot of negative consequences that can come from this. Caregivers, if they leave the workforce, and this is common with women and people of color, if they leave the workforce, they're not paying into Social Security anymore. So then they get a smaller benefit later on in retirement. They also might have to leave their 401ks or any other type of retirement account they get at work, and then they have less savings. They're spending more of their money on the day-to-day, so there's not that much for them to put into an IRA. There are just so many different aspects that will affect retirement later in life. So it's nice to see that benefit.
Yeah, and I think revisiting benefits, if you're a small employer, large employer, a not-for-profit, a for-profit, a government, now's the time to take a look at benefits, see how your workforce adapted or didn't adapt, and try to make appropriate changes. Well, Ali, I want to go to a quick commercial break, and we talked about retirement. Now we're going to flip gears and talk about healthcare. We'll talk about the ways that you may get your healthcare in the future. You're going to want to stay tuned right here on BRN AM. Imagine a new television network that will make you richer, healthier, and in control of your financial future. This network is for the policewoman in Nashville, Tennessee, the baker in Dubuque, Iowa, the teacher in Lexington, Kentucky. We want to make the idea of savings and retirement culturally relevant. But what do you see as a defining issue of the midterms? Especially for the smaller businesses. I mean, they are the lifeblood of the American economy. Featuring exclusive interviews, current affairs, and docuseries. 33 years old, you retired early.
The philosophy is money only matters if it helps you live a life that you love.
But you got to start thinking about retirement as soon as you get in.
The Broadcast Retirement Network will drive very high engagement with premium partnerships. So this isn't retirement and savings for your parents or grandparents. This is for all Americans. And we're going to change the way you think about money. Welcome to the next frontier of retirement and savings. This is BRN, the Broadcast Retirement Network.
Hi folks, Joe Namath here, and if you're on Medicare, this is important. You're now entitled to eliminate co-pays and get dental care, dentures, eyeglasses, prescription coverage, in-home aids, unlimited transportation, and home-delivered meals, all at no additional cost. Plus, your zip code may have coverage with the Give Back benefit that adds money back to your Social Security check every month. Look, with the uncertainty of the virus and vaccines, you need to get everything you're entitled to. Here's the bottom line. Call to get significant benefits at no additional cost and see if your zip code has coverage with the Give Back benefit. Millions of people have trusted the Medicare Coverage Helpline. You can too. Call now. It's free.
Call 1-800-924-3920. That's 1-800-924-3920.
Welcome back. We're talking to Alessandra Melito. She's a journalist with MarketWatch. Allie, thank you as always for staying with us this morning. We really appreciate it.
Yeah, of course. Happy to be here.
Yeah, so let's flip gears. Let's talk about, the great thing about what you do and some of your a lot of your colleagues at MarketWatch. You cover a lot of different topics. We talked about retirement, and look, I would argue that healthcare is part of retirement. You're going to need healthcare in retirement, so it is part of the retirement discussion. But let's talk about some of the changing ways that you, we, me, all of us are going to be getting healthcare going forward, and lessons learned from this pandemic.
Yeah, absolutely. I mean, healthcare is absolutely a part of retirement. It's one of the major expenses that retirees have, more so than somebody who's younger, currently in the workforce. The pandemic has affected society in nearly every capacity, and one of the most major ones, of course, is healthcare. I mean, we've seen, like, if you look in the headlines, the hospitals and nursing homes and just how people are taking care of themselves. It's all been in the headlines for the last almost year. So healthcare is definitely something that will be changing as a result of the pandemic. There are a few ways. I typically, as the retirement reporter, I focus on older Americans, but this is something that will benefit everybody. For example, telehealth. So right now, a lot of Americans are getting their doctor visits in over the phone or with a video camera. I know for even like my grandmother, she used to have to go into the doctor's office, and now they're allowing her to just use my smartphone, and they talk over the smartphone, which is nice. That's something that is probably going to be more common as we move on, just because society, we're not quite there yet with feeling comfortable going out regularly. So that's one thing. Another thing is at-home care. So a lot of people, eventually they go to a nursing home. That's something that they decide to do, or their family, helps them make that decision. But a lot of people will probably start moving to at-home care, not only because they feel more comfortable doing so. I mean, you're at home, you're surrounded by the things and the people that you are comfortable with, but it's also, in some cases, it could be safer. Unfortunately, nursing homes were they were a hotspot for the COVID-19 virus. Unfortunately, something that we've seen since the height of the pandemic in March, almost a year ago, is that nursing homes were really hard hit. They make up a majority, or not a majority, but they make up a high percentage of the deaths in the country. And it's not because people aren't taking care of them, like the nurses, the staff, the doctors, they're all doing the best that they can, but they're in a community setting. And when you are with vulnerable people and you're also, taking care of all those vulnerable people, it's very possible that the virus will move from one person to the next person to the next person, despite, your best efforts. So I think something that families will be discussing more is at-home care. And that can come from doctor visits at home, or, building or buying equipment that, they have these beds and other tools that they have at home. I just think that aging in place is something that is going to be more popular among Americans. Those, I think, are two major components.
Yeah. And Allie, let me jump in and let me ask you about one thing I found very fascinating with the individual that you interviewed, and I don't recall his name, but it was preventative care. And so if you're 20 years old right now and you're watching this program, because we have a lot of younger people who watch the program as well as mature Americans and non-Americans watching the show, preventative care, understanding what you have predisposition towards is really important to preventing cancer, diabetes, and some of the other major maladies that are affecting some of our older and even middle-aged Americans, right? So that preventative technology, the ability to sense that and understand what you could get, allows you as a 20-year-old, a 22-year-old to take the steps you need to prevent problems in the future.
Yeah, I mean, that's a big thing. So I spoke with Philip Mueller, who is an author. He's written about Medicare, he's written about Social Security, and now he's written about healthcare. And his main focus is always on getting the most that you can out of these things. And healthcare in particular is such a beast to try to beat because it's so complex. And a lot of people, because it's so complex and sometimes it's so expensive and you don't understand the insurance component of it, they don't take care of themselves the way that they should. So he focused in one part of our interview, he talked a lot about preventative care, because when you're younger, you think, I don't need to take care of this, I don't need to do that, I'm healthy, I'll bounce back, things like that. But when you don't take care of yourself in those ways, whatever ailment you have, it either, even if it does go away for the time being, it's probably going to show up again later on in life in a few decades. And you're going to be making it worse for your older self. Not only in the ways of maybe having those ailments and then other chronic illnesses, but also the expenses. Healthcare is expensive. It does not get less expensive. And as you get older, you're going to see those bills, they come up more, unfortunately. So he was saying that younger Americans should really be taking care of themselves. If you don't feel well, go to the doctor. Find a doctor that you actually want to have a relationship with, because having a doctor that you actually have a relationship with, as opposed to just going to an urgent care, in March, and then in August, if you don't feel well, going to another urgent care and having a different doctor, having that one doctor, he or she will know you better and be able to take care of you better. You'll have that history. And while it is possible to have your history shown up in documents, in all those different portals that the doctors have when they look at their tablets, it's not quite the same as a doctor who you've been going to for the last year or 2 years or 30 years know you that way. I know, for example, my grandfather, he had his doctor for 40 years. They were friends by the end of it. But that doctor knew everything. He knew the medications he was taking, so he knew which medications not to suggest to him. He knew, just different ailments that he had. He knew when my grandfather was maybe, being a little dramatic or a little nervous, as opposed to when it was something serious. So having that relationship is a form of preventative care in and of itself. But on top of that, you should definitely go to the doctor if you don't feel well, and you should go to a specialist if there's a bigger issue going on, just so that you don't hurt yourself later in life.
Yeah, I certainly agree. And today, in today's world, I'll just close out with, in today's world, there is that transactional element to conducting business, right? You can go on Zoom, Skype, and then you're not thinking about it. But having that rapport with a doctor, a dentist, an attorney, let's not even talk about healthcare, will help customized solutions for you. Well, Allie, it's a pleasure talking with you. Great to see you this new year. And we look forward to having you back on the program again very soon.
Yeah, nice seeing you. Thank you.
That wraps up this episode of BRN AM. Have a topic of interest, someone you think we should talk to? Then drop us a line. And don't forget, for all the information in markets, retirement, technology, personal finance, so much more, all in one place, check out today's edition of The Morning Pulse. Don't forget, we're back again tomorrow for BRN Weekly. We'll have a very special guest, and we'll take a look at some of our best segments for the week. So until then, I'm Jeff Snyder. Stay safe, keep on saving, and don't forget, roll with the changes.
Are you being audited and do you owe the IRS $10,000 or more in back taxes? Is the IRS threatening to take more of your money? Don't fight the IRS alone. The Tax Doctor is here to help you negotiate your tax bill and reduce your stress. The IRS can freeze your assets and seize your bank accounts, but you can stop these IRS actions. The Tax Doctor will work with you using our years of experience to represent your case to help you get the best resolution under the IRS guidelines. Help is here to deal with the IRS to reduce your stress. We've handled thousands of cases, so we know what we're doing. If you owe $10,000 or more in back taxes, do not call the IRS alone. Call a Tax Doctor now for a tax emergency analysis.
Call 800-224-6439.